Osteoarthritis is one of the most common joint disorders, affecting millions of people worldwide. It typically causes pain, stiffness, and reduced mobility in the affected joints. Diagnosing osteoarthritis is crucial for effective management and treatment. In this video, we'll walk you through the step-by-step process doctors use to diagnose osteoarthritis, from the initial consultation to confirming the diagnosis with imaging and laboratory tests. Understanding this process can help patients know what to expect and why each step is important for accurate diagnosis and personalized care. The diagnostic journey begins with a detailed patient history. Doctors ask about the onset, duration, and nature of joint pain, as well as any stiffness or swelling. They also inquire about daily activities, previous injuries, family history of joint diseases, and any other medical conditions. This information helps the doctor understand the context of the symptoms and identify risk factors that may contribute to osteoarthritis. A thorough history is essential because it guides the next steps in the diagnostic process and helps rule out other potential causes of joint pain. Next, doctors focus on the specific symptoms experienced by the patient. They ask about the location of pain, its severity, and whether it worsens with activity or improves with rest. Stiffness, especially in the morning or after periods of inactivity, is a key symptom of osteoarthritis. Swelling, reduced range of motion, and any sensations of joint instability are also discussed. This symptom assessment helps doctors differentiate osteoarthritis from other joint conditions, such as rheumatoid arthritis or gout. After gathering the patient's history and symptoms, the doctor performs a physical examination. This involves inspecting the affected joints for swelling, redness, or deformity. The doctor gently palpates the joint to check for tenderness and warmth. They also assess the range of motion by asking the patient to move the joint in different directions. Crepitus, a crackling or grating sound during movement, is another sign doctors look for. The physical exam provides valuable clues about the presence and severity of osteoarthritis. During the physical exam, doctors pay close attention to how the joint moves. They look for any limitations in movement, pain during motion, or abnormal joint alignment. Observing the patient's gait, or the way they walk, can also reveal subtle changes caused by osteoarthritis. These observations help doctors determine which joints are affected and how much the disease has progressed. It also assists in planning further diagnostic steps and potential treatments. Swelling and tenderness are common in osteoarthritis, especially during flare-ups. The doctor gently presses around the joint to identify areas of tenderness and swelling. This helps distinguish osteoarthritis from other inflammatory joint diseases, which may present with more pronounced swelling or warmth. Identifying these signs is important for confirming the diagnosis and ruling out other conditions that can mimic osteoarthritis symptoms. A key part of the physical exam is evaluating the joint's range of motion. The doctor asks the patient to move the joint in various directions, noting any pain, stiffness, or restriction. Limited range of motion is a hallmark of osteoarthritis and can indicate the extent of joint damage. This evaluation not only helps in diagnosis, but also provides a baseline to monitor disease progression and response to treatment over time. Crepitus refers to a crackling or grating sound that can be heard or felt when moving a joint affected by osteoarthritis. Doctors listen for this sound during the physical examination, as it often indicates cartilage breakdown within the joint. While crepitus is not exclusive to osteoarthritis, its presence, along with other symptoms, strengthens the diagnosis. This subtle sign can sometimes be missed, so doctors are careful to check for it during joint movement. In advanced cases of osteoarthritis, joint deformity may become apparent. The doctor examines the joint for any visible changes in shape or alignment, such as bony enlargements or nodules. These deformities are often the result of chronic cartilage loss and bone remodeling. Identifying joint deformity helps determine the stage of osteoarthritis and can influence treatment decisions, such as the need for surgical intervention. Based on the patient's history, symptoms, and physical examination, the doctor forms an initial diagnosis. Osteoarthritis is often suspected when there is joint pain that worsens with activity, morning stiffness lasting less than 30 minutes, and physical signs such as crepitus or bony enlargement. However, to confirm the diagnosis and rule out other conditions, further tests are usually required. At this stage, the doctor discusses the next steps with the patient. Imaging tests are essential for confirming osteoarthritis and assessing the extent of joint damage. The most common imaging test is an X-ray, which can reveal characteristic changes such as joint space narrowing, bone spurs, and changes in bone shape. In some cases, doctors may order MRI or ultrasound scans to get a more detailed view of the joint's soft tissues and cartilage. These tests help differentiate osteoarthritis from other joint diseases and guide treatment planning. X-rays are the gold standard for diagnosing osteoarthritis. They can show joint space narrowing, which indicates cartilage loss, as well as bone spurs, osteophytes, and changes in bone structure. These findings are typical of osteoarthritis and help confirm the diagnosis. However, it's important to note that the severity of X-ray changes does not always match the severity of symptoms. Some people may have significant X-ray findings but only mild symptoms, and vice versa. While X-rays are most commonly used, MRI and ultrasound can provide additional information, especially in early or complex cases. MRI is particularly useful for visualizing soft tissues, cartilage, and early joint changes that may not appear on X-ray. Ultrasound can help detect fluid in the joint or inflammation of surrounding tissues. These advanced imaging techniques are not always necessary, but can be valuable in certain situations where the diagnosis is unclear. Laboratory tests are not used to diagnose osteoarthritis directly, but they help rule out other conditions that can cause similar symptoms, such as rheumatoid arthritis or infection. Blood tests may be ordered to check for markers of inflammation or autoimmune disease. In some cases, joint fluid may be aspirated and analyzed to exclude gout or infection. These tests ensure that the diagnosis is accurate and that other treatable conditions are not missed. Blood tests are performed to look for signs of inflammation or autoimmune activity, which are not typical of osteoarthritis. Elevated markers such as ESR or CRP may suggest another diagnosis, like rheumatoid arthritis. Specific antibodies, such as rheumatoid factor or anti-CCP, can also be checked. Normal blood test results support the diagnosis of osteoarthritis, while abnormal results may prompt further investigation for other joint diseases. In some cases, doctors may perform a procedure called joint aspiration, where a small amount of fluid is withdrawn from the affected joint using a needle. This fluid is then analyzed in the laboratory to check for signs of infection, crystals as seen in gout, or inflammation. Joint fluid analysis is especially useful when the diagnosis is uncertain or when infection or other types of arthritis need to be ruled out. Osteoarthritis shares symptoms with several other joint diseases, so doctors must carefully differentiate it from conditions like rheumatoid arthritis, gout, or infectious arthritis. This process, called differential diagnosis, involves considering all the information gathered from the patient's history, physical exam, imaging, and laboratory tests. Accurate differentiation ensures that the patient receives the most appropriate treatment for their specific condition. Doctors often use established clinical criteria to diagnose osteoarthritis. These criteria include age over 45, persistent joint pain, morning stiffness lasting less than 30 minutes, and physical findings such as crepitus or bony enlargement. The combination of these features increases the likelihood of osteoarthritis and helps standardize the diagnostic process. Using clinical criteria ensures consistency and accuracy in diagnosis across different healthcare providers. Medical organizations, such as the American College of Rheumatology, provide guidelines for diagnosing osteoarthritis. These guidelines outline the recommended steps and criteria for diagnosis, ensuring that patients receive evidence-based care. Doctors refer to these guidelines to confirm their clinical judgment and to stay updated on best practices. Following guidelines helps maintain high standards of care and improves patient outcomes. Throughout the diagnostic process, clear communication between doctor and patient is essential. Doctors explain the reasons for each test, what the results mean, and what to expect next. This helps reduce anxiety and ensures that patients are fully informed about their condition. Good communication also fosters trust and encourages patients to participate actively in their care. Once the diagnosis of osteoarthritis is confirmed, the doctor takes time to explain the condition to the patient. This includes discussing what osteoarthritis is, how it affects the joints, and what the future may hold. Understanding the diagnosis empowers patients to make informed decisions about their treatment and lifestyle. It also provides an opportunity to address any questions or concerns the patient may have. After diagnosis, the doctor discusses available treatment options with the patient. These may include lifestyle modifications, physical therapy, medications, or, in severe cases, surgical interventions. The choice of treatment depends on the severity of the disease, the patient's preferences, and overall health. Collaborative decision-making ensures that the treatment plan is tailored to the patient's needs and goals. Osteoarthritis is a chronic condition, so ongoing monitoring is important. Doctors schedule regular follow-up visits to assess symptoms, joint function, and response to treatment. Imaging or laboratory tests may be repeated if there are changes in symptoms or concerns about disease progression. Monitoring allows for timely adjustments to the treatment plan and helps prevent complications. Patients also play a key role in monitoring their own symptoms. Keeping a symptom diary, Noting changes in pain or mobility and reporting new symptoms to the doctor are all important. Self-monitoring helps patients recognize patterns, triggers, and the effectiveness of treatments. It also supports shared decision-making and improves overall disease management. Early diagnosis of osteoarthritis allows for timely intervention, which can slow disease progression and improve quality of life. Recognizing symptoms and seeking medical attention promptly is crucial. Early treatment can help preserve joint function, reduce pain, and prevent disability. This highlights the importance of awareness and education about osteoarthritis among patients and healthcare providers. Diagnosing osteoarthritis can be challenging, especially in the early stages when symptoms are mild or overlap with other conditions. Some patients may have atypical presentations or multiple joint diseases at once. Doctors rely on a combination of clinical skills, imaging, and laboratory tests to make an accurate diagnosis. Awareness of these challenges helps ensure that no cases are missed or misdiagnosed. During the diagnostic process, doctors are vigilant for red flags that may indicate a more serious condition, such as infection, fracture, or malignancy. Symptoms like severe pain, rapid joint swelling, fever, or unexplained weight loss require urgent investigation. Identifying red flags ensures that potentially life-threatening conditions are not overlooked and that patients receive prompt and appropriate care. In some cases, doctors may refer patients to specialists, such as rheumatologists or orthopedic surgeons, for further evaluation. Specialists have advanced training in joint diseases and can provide additional expertise in complex or unclear cases. Referral ensures that patients receive comprehensive care and access to the latest diagnostic and treatment options. Sometimes, patients seek a second opinion to confirm the diagnosis or explore alternative treatment options. This is especially common when the diagnosis is uncertain or when major treatment decisions are being considered. Second, opinions can provide reassurance, new perspectives, and help patients make informed choices about their care. Educating patients about osteoarthritis is a vital part of the diagnostic process. Doctors provide information about the disease, its causes, risk factors, and management strategies. Education empowers patients to take an active role in their care, make lifestyle changes, and adhere to treatment plans. Well-informed patients are more likely to achieve better outcomes and maintain a higher quality of life. Doctors assess the patient's lifestyle, including physical activity, diet, weight, and occupational factors. These elements can influence the development and progression of osteoarthritis. Addressing modifiable risk factors, such as obesity or repetitive joint stress, is an important part of both diagnosis and management. Lifestyle assessment helps tailor recommendations to each patient's unique situation. A family history of osteoarthritis or other joint diseases can increase a person's risk. Doctors ask about relatives with similar symptoms or diagnoses to identify potential genetic factors. Understanding family history helps in assessing risk and may influence the approach to diagnosis and prevention. Certain occupations that involve repetitive joint use or heavy lifting can increase the risk of osteoarthritis. Doctors inquire about the patient's work history and daily activities to identify occupational risk factors. Addressing these factors can help prevent further joint damage and guide recommendations for workplace modifications or alternative activities. Physical activity levels are assessed to determine their impact on joint health. Both excessive and insufficient activity can affect osteoarthritis risk and progression. Doctors recommend balanced exercise routines that promote joint health without causing overuse injuries. This assessment helps in creating personalized activity plans for patients. Nutrition plays a role in joint health and overall well-being. Doctors discuss dietary habits, focusing on nutrients that support joint function, such as omega-3 fatty acids, vitamins, and minerals. Addressing nutritional deficiencies or unhealthy eating patterns can help manage symptoms and improve outcomes for patients with osteoarthritis. Doctors assess how joint pain affects the patient's daily life, including work, hobbies, and social activities. Understanding the impact of pain helps tailor treatment plans and set realistic goals for symptom management. It also provides insight into the patient's coping strategies and support needs. Chronic pain and reduced mobility can affect mental health, leading to anxiety or depression. Doctors ask about mood, sleep, and emotional well-being as part of the diagnostic process. Addressing mental health is important for comprehensive care and can improve both physical and psychological outcomes for patients with osteoarthritis. Doctors evaluate how osteoarthritis affects the patient's ability to perform daily tasks, such as walking, climbing stairs, or dressing. Functional assessments help determine the severity of the disease and guide recommendations for physical therapy or assistive devices. Improving function is a key goal in osteoarthritis management. Many patients with osteoarthritis have other health conditions, such as diabetes, heart disease, or obesity. Doctors screen for comorbidities to ensure comprehensive care and to address factors that may influence treatment choices. Managing comorbidities can improve overall health and enhance the effectiveness of osteoarthritis treatment. Accurate documentation of all findings is essential for continuity of care. Doctors record the patient's history, physical exam results, imaging and laboratory findings, and the rationale for the diagnosis. Good documentation ensures that all healthcare providers involved in the patient's care have access to the necessary information and can coordinate treatment effectively. At the end of the diagnostic process, doctors review all the information gathered to ensure nothing has been overlooked. This comprehensive review helps confirm the diagnosis and ensures that the patient receives the most appropriate care. It also provides an opportunity to revisit any unclear findings or address new concerns that may have arisen during the evaluation. To summarize, diagnosing osteoarthritis involves several key steps: taking a thorough patient history, assessing symptoms, performing a physical examination, ordering imaging and laboratory tests, and using clinical criteria to confirm the diagnosis. Each step plays a vital role in ensuring an accurate and timely diagnosis, which is the foundation for effective treatment and improved patient outcomes. Diagnosing and managing osteoarthritis often requires a team approach. Doctors, nurses, physical therapists, and other healthcare professionals work together to provide comprehensive care. This collaborative approach ensures that all aspects of the patient's health are addressed and that treatment plans are coordinated for the best possible outcomes. Empowering patients with knowledge and support is a cornerstone of osteoarthritis care. When patients understand their diagnosis and treatment options, they are more likely to participate actively in their care and achieve better results. Education, communication, and shared decision-making are key elements in empowering patients throughout the diagnostic and treatment journey. In conclusion, diagnosing osteoarthritis is a step-by-step process that combines clinical expertise, patient input, and advanced diagnostic tools. Early and accurate diagnosis is essential for effective management and improved quality of life. If you or someone you know is experiencing joint pain or stiffness, seeking medical advice is the first step toward understanding and managing osteoarthritis. Remember, with the right care and support, it's possible to live well with this condition.